Welcome back. This week is Drug Alcohol Facts Week. It's a time dedicated to raising awareness about substance use and abuse and helping young people and families get the facts that they need to stay safe and supported. Today, we're joined by a licensed behavioral health clinician from the VNS, that's the Visiting Nurse Services of New York, and the Integrated Mental Health Clinic to help us unpack what's driving substance use among young people and so much more. So please welcome to the show, Denise Santana. Welcome.
Thank you. I'm glad to be here.
Hey, happy to get the knowledge that you have to offer. Denise, thanks for joining us today. And we know from recent research that the Bronx is high in numbers of youth with substance use disorders than any other borough. I don't know why that is. I mean, it's all over the place. What factors can lead to substance use or abuse among kids and young adults?
That's a good question. So there are multiple risk factors. Among them are genetics. Other things can be, for example, family behavioral patterns. Other times it's how people cope with trauma, or they're trying to mask, hide, numb, or escape from some type of painful experience or uncomfortable, difficult emotions. Other times, there's other factors that lead into it. Can also be just the fact that it could be external factors as well.
Yeah.
So external pressures such as bullying. There's also things such as the media, right? So with social media influences, a lot of times tying into the fact that where a lot of times the media itself can tend to normalize substance use.
Yeah.
And so teens look at alcohol and drugs and they will kind of perceive it as, okay, well, this is normal behavior. This is a normal way to cope with stress.
Yeah.
Not realizing the consequences behind it. There's lots of other factors as well.
Environment.
Yeah, the environment is particularly, yes. But integrative care at the end of the day is important, especially when it comes to mental health and substance use disorder.
Yeah.
And so being able to treat both at the same time is very essential.
Yeah. I have Narcan and a number of things in my vehicle that,
Yeah.
I'm trained to help bring people back to life. And I did it one time and did that first spray, no reaction. Of course, you do the things that you have to do. And then that second spray, the guy wiggled and said, "Yo, man," he said, "you're messing up my eye."
Yes.
I brought him back to life. So I saved your life. But
So it's normal.
It's difficult. It's normal.
It's normal for them to react that way because they're thinking that they're high or they've reached that sense of euphoria, but they don't realize that they're dying.
Yeah.
And so
the
fact
heart is
that
ready
you
to
did
stop.
that, yes.
Yeah.
But they're not aware of that. So
What are some of the common misconceptions about substance abuse and use disorders?
another good question. So the thing with substance use disorder is that it is a medical condition. So just like diabetes and any other medical condition, except that it's tied to the brain. And so this is why it's important to treat it medically as well as with, the mental health piece.
Tied to the brain, meaning very addictive.
Meaning that it affects the brain mostly.
Yeah.
Because it affects it alters how the brain works.
Yeah. So when people come to the Visiting Nurse Services for help, they feature all of these things to help people in our community?
Yes, so we do offer all different types of. We have an integrated team which caters to all different types of needs. So we have prescribers, we have nurse practitioners, we have peer specialists, we have therapists. We also offer support groups. So there's a lot of things that we have to offer to the community and to people who are in need or are looking for support, or they may be looking for it for somebody else.
Now, do they come to a facility, or you have an outreach where you go out and you visit, Visiting Nurse Services?
So, I mean, we have our integrated clinic is located in the South Bronx. And so with that, anyone who's looking for help for themselves or for somebody else, they can reach out to us. They can call us, or they can come visit our South Bronx office for more information. And if they're looking for options to explore treatment for whenever they feel ready.
Right.
It's no pressure, no judgment.
No pressure, no judgment. You remind me of my little niece who was selling popcorn for a fundraiser. She said, Bob, can you da-da-da-da-da-da? No pressure.
Love that. Entrepreneur in the making.
I know. Yeah, you just took me there for a hot second. But what advice would you have for young people who might be struggling with, where to go, what to do?
Right.
How do I conduct my life the way I want to without getting involved in substance abuse?
Thanks. I'm glad that you bring that up, because a lot of times they don't even know that that there is a problem, and substance use can creep up gradually.
Yeah.
So with that being said, there's that portion. Also, habits form without us even realizing it. So I'll give you a quick example. A person could be standing at the bus stop vaping, and to them it's just completely harmless, right? The other thing is that patterns build over time. So this is why it's important to get information, seek support, because with that support, they would be able to help you to understand what's going on and how to explore other options for whenever the person is ready.
Yeah. And when we talk about substance abuse, what are we talking about? Are we talking about alcohol?
We're talking alcohol,
weed?
Drugs.
Yeah. Vaping
alcohol,
is included. Cigarettes.
All of that.
Yeah.
All of that. It's all encompassing.
Where does it start? I mean, is there a bottom to this? Like they say, cigarette smoke is addictive, and you want to try that, then you want to go to vaping, and does it follow a pattern or a path?
I want to say it's
into
different.
Deeper addiction.
Right. And thank you for asking that. I feel like it's different for everyone. Everyone has different tolerance levels.
Yeah.
And at the same time, knowing that all these things do affect the brain at some point,
Yes.
particularly in young people, because the prefrontal cortex is the part of the brain that takes the longest to develop. Say about age of 25 is when it's fully developed. So people younger than that tend to have a harder time trying to stop, even when they want to. Additionally to that, it can also impact their impulses. So all of those things.
I know vaping is, it's out there in our communities, and a lot of people are doing it.
Yes.
What are some of the symptoms of vaping? What can it do? What can people do to avoid it or try to stay away from it?
Thank you. Good question. So you're asking a lot of great questions. Thanks. So with vaping, it can impact the lungs. It impacts your ability to breathe. A lot of times, we're seeing a lot of people younger and younger moving towards the vaping. And I think what's getting a lot of the younger people is the fact that the vaping comes in flavors now. So for them, it's like, oh, candy, but I'm vaping the candy. So there's different types of flavors for the vaping, and I think that's what draws a lot of the younger people in.
Yeah, I know of a few people who are sort of in that area.
Yeah.
Where they are vaping, and I think it is the different flavors. Oh, you got to try this. You got to try it.
Yes,
did you try this?
Yes, and there's the peer pressure, you know, so with all of that. But, it should be something where it's okay to have conversations surrounding substance use, surrounding seeking support. It's nothing to be ashamed of. Keeping an open mind and talking, just getting the conversation started without any criticism or judgment, because that too can shut people down. It doesn't matter what age. If you're talking to someone and you start criticizing them and judging them before you can even get to the heart of the conversation and the principle of it, people will shut down.
Denise, what support can you, or advice that you can give to young people who are looking to straighten themselves out, if they're on it already?
Sure, great question. So for young people who are on it already, or they know someone who might be on it and they want to seek help, they can reach out. There's different types of support out there. So in our integrated clinic, we have peer specialists, we have family advocates for youth and families. So in addition to that, like if there's families who need support as well, or they're looking for their loved one who needs support in substance use, then that's something where they can also seek support.
Are there other kinds of care that your team provides
Yes.
to youth?
So,
Is it only to youth or?
No, we offer to people of all ages all over New York City, and we take all types of insurances, including Medicaid and Medicare, and we don't decline services if people are unable to pay.
Yeah.
So we offer support groups, we have individual therapy, we also have, like I said before, we have peer specialists, we have therapists, and with the peer specialists, the beauty of a peer specialist is that they have lived experience. So they know firsthand what someone might be feeling in regards to exploring if they're ready, how to seek options for treatment, if they're ready for treatment. And so that type of hope and connection can be a powerful medicine for someone.
Denise, I have a feeling that your publicist wants to ask a question. I can feel her. What is that? What is her name?
BB?
BB, the question that you wanted her to ask or answer is what? Shout it out.
What can families do if they want more information? Where can families start?
Well, they can call us, reach out.
Well, the question was, what can families do? Say it again.
What should families do if they think their kid's at risk?
I was thinking the same thing before I went to you. I said,
So
what can families do if they want to, seek help?
Right, so communication is definitely key, as I was saying earlier. So making sure that you have a conversation, it doesn't matter how you started off, as long as it comes from a place of love and intention, curiosity, then that could be a great starting point. Just start the conversation. And also knowing that there's nothing to be ashamed of. And again, coming from a place of love, not guilt or shame or criticism, that helps and it goes a long way.
Wonderful. Great information. Thank you so much.
Thank you.
Give her a big hand, everybody. Denise.
Thank you. I'm glad to join.
Denise Santana, behavioral health clinician, VNS Health. We can social media. Where can we go?
Well, you can go to vnshealth.org or you can contact us directly at our South Bronx office. The number is 718-742-7000, or you can just stop by at the Bronx office and come explore options or seek more information, and someone will be happy to help.
Of course, VNS is a nonprofit organization.
It is.
Yeah.
Yes.
Thank you so much for sharing.
Thank you.
Come back
I'm glad
again,
to
okay?
join. Thanks.
All right, you got it. We'll take a quick break right here. I've got more open notes all coming your way next.